This video will focus on return to school guidelines. The information has been provided by the Ontario Neurotrauma Foundation's Best Practice Guidelines for Concussions and Mild Traumatic Brain Injuries. There has been an increase in the understanding of the impact that concussion and mild traumatic brain injury symptoms have on the ability for students to manage their academic programs. As such, development of specific academic management strategies is imperative for students to aid them in their ability to resume cognitive activity without exacerbating their symptoms. The basis of managing cognitive exertion is that cognitive activity must be paced in order to avoid exceeding the threshold at which symptoms are exacerbated. It is recommended that the management strategies that are implemented should be highly individualized, as the manifestation of symptoms and their impact upon students are as variable as their recovery. If the student is asymptomatic, they should attend school as tolerated. However, they should not undergo evaluations, or they should be allowed to write with accommodations such as pace breaks and additional time while being monitored for potential symptoms. If the student is symptomatic, they should refrain from attending school along with participating in any academic or sport-related activities. The student should be offered psychoeducation and modified at-home study tasks as tolerated. It is important to note that students should be able to tolerate school and life responsibilities before partaking in sports or activities that could put them at risk. The student may return to academic activities as tolerated so long as they remain asymptomatic. If the student is still symptomatic, they should refrain from attending any academic activities for 1 to 2 weeks should the symptoms remain functionally debilitating, connect with academic accessibility services for accommodations and additional support. The healthcare professional, with permission, should also ensure that the services are notified that a concussion has occurred and that the student will require time off as well as potential accommodations and support for reintegration, and be monitored for the emergence of potential symptoms and be provided with support and education. Students should continue to refrain from academic activities if symptoms continue to be functionally debilitating. The healthcare professional should again contact accessibility services that the student is still symptomatic and to continue with accommodations and support. The student should begin to attend school as tolerated with accommodations even if they are still experiencing symptoms. A healthcare professional with experience in concussion and mild traumatic brain injury rehabilitation should provide guidance to the student and educators. Should reintegration into school be ineffective at the 4-week post-injury mark, for example, if symptoms plateau or continue to get worse, the following should be considered. Screen for ADHD, learning disabilities, anxiety, and depression. If present, seek assistance from specialized services. Conduct a reassessment by a rehabilitation provider with concussion knowledge to evaluate for possible return to school barriers, and refer the student for a neuropsychological assessment. Work with the instructor and the student to look at the cognitive demands of various classes, with consideration of the student's current symptoms to decide if accommodations can be made within the following areas: curriculum, environment, activities, and schedule. Consider moving the student's courses to audit status, allowing them to participate in academic activities without the added pressure of evaluations. And finally, review whether it is appropriate for the student to continue in the program for the remainder of the term if participation will have a negative impact to their grades. It is important to contact the school registrar immediately following the injury in order to ensure that the student has as much support as possible. Other individuals who might be involved in the management plan, including cognitive rest and academics, include academic support staff, team physicians, course instructors, and disability services. For healthcare professionals, Algorithm 12.2 can be found below this video to aid in considerations for return to school planning for students 18 years of age or older following an injury. For further information regarding return to school guidelines, you can refer to Section 12 of the Ontario Neurotrauma Foundation's Guidelines for Concussions and Mild Traumatic Brain Injuries and their persistent symptoms. Special acknowledgements go out to the Kinesiology Department at the University of Waterloo, the Centre for Community, Clinical and Applied Research, and the Ontario Neurotrauma Foundation, which provided the funding for this video.